So, pretty much as a follow-up to to the earlier talk, we've actually done a study where we compared outcomes of the next-gen and the Persona. We are looking. This study is in terms of the cruciate retaining designs. So it's clearly, we all know that it plays, knee arthroplasty plays a big role in the management of the arthritic knee by reducing pain, improving joint function, and restoring functional activity. Certainly in this part of the world, deep knee bends, squats are a necessary part of our social and religious requirements. And the patient satisfaction in terms of reduced pain, good range of motion, stability, and ability to carry out activities of daily living, including deep flexion, constitutes an integral part of our requirement. The real issue with the next-gen system, which in the Australian registry and most of the registries across the world was probably the best serving and best functional implant. There were down issues with this, the issues of overhang, which to some extent got solved by the high flex and the gender design. And even between the next gen and the Persona, there has been a substantial improvement. We'll just go through over this in a minute. So when you look at the anterior flange thickness, for instance, in the next gen, it is substantially more, and it's the differential between the next gen and Persona is almost about 2.2 millimeters. It's a shorter flange. So we undertook a study to compare the outcomes, and we looked at the following data: the PROM, the range of motion, and the anterior knee pains. It was hard to look at the other criteria given that the next-gen systems performed so well, and they were both functionally excellent outcome designs. So when you compare the two, there are 23 sizes of the femur. When you look at the standard narrow, 9 sizes of the tibia, 8 tibial inserts, 6 patellar sizes. The J curve is different, the femoral groove is deeper, the anterior flange is shorter, the tibial base plate is anatomical, we just talked about it, and the increment on the tibial side is 1 millimeters as opposed to 2 on the next gen side. So we looked at 401 patients, simultaneous bilateral patients between 2014-16, so our follow-up was 2 years, 206 Personas, 195 next gen CRs. Very small print, I hope you can see that. The demographic of the two groups of patients were quite comparable. We had the same technique, we did not alter anything. Medial parapatellar, fixed bearing cemented, unresurfaced patella, and we looked at the PROM data and quantified preoperative to postoperative improvements in patients, and we looked at patient-reported satisfaction levels and whether their expectations after TK were met or not, and to quantify functional recovery and ease of doing activities of daily living. We used two PROM data, the Oxford knee score and the forgotten joint score, measured at 6, 12, and 24 months. The Oxford knee score we've already heard about in the earlier presentation, validated for use in randomized controlled trial in total knee arthroplasty. And the forgotten joint score is a PROM which assesses joint awareness and activities of daily living. It has 12 questions with 5-point Likert response format, and high value indicates the ability of the patient to forget about the fact that he or she has had a joint arthroplasty. We did not look at WOMAC and the KSS scores because of the fact that we were looking at functional outcomes, so these two criteria were not actually looked at. We looked at range of motion, which is measured by a physiotherapist using universal goniometer. Criticism of the study may be that we could have had greater accuracy using radiographic options. And when you look at the outcomes, we find that the scores in the initial period are very, very similar. But as you progress from 6 months to 12 months, there appears a difference between the outcomes in terms of the OKS and the forgotten joint score, with a slightly higher preponderance of favorable results on the Persona side. The range of motion again at 6 months is fairly comparable, it's almost identical in fact, and yet at 12 months there's a difference of about 6 degrees. There is a difference, but it is not statistically significant. But the one criteria which I think is really quite remarkable, certainly in our experience, is the incidence of anterior knee pain And if you see at 6 months, it's very similar, 8.3 and 9%. But when you look at these, review these patients at 12 months, there's a substantively, statistically significant difference between the two options, between 7 and 12.5 degrees. So we believe the reason for this is a better match of the shape and sizes for ethnicity, gender, and stature. It's high flex without actually having to take excessive bone. There are 23 sizes and much better patellofemoral kinematics. And this is the kinematic design. We have the more contemporary designs between 3 of the available implants. And you can see that there is a substantive difference in the Persona and the next gen trochlear notch. Is deeper, wider, and because the flange of the anterior part of the component is narrower, the patellar tracking is much better. In terms of the patellofemoral kinematics, again, the degree of flexion of the sulcus angles at various degrees of flexion. At 45 degrees, it has a pretty deep 147, almost 148 degrees of angle at that degree of flexion. So this is the evolution of the trochlear compartment geometry. So the mismatch between tibial rotation and maximal coverage is not desirable, and as we just heard, as said, most unsatisfied patients have an internally rotated tibia, almost 86% of all failures, and the anatomic symmetric tibia addresses this quite well, and the symmetric and lateral compartments grow disproportionately as the sizes increase. So now we also have availability of the micro sizes, the size 1 and the 2, where the distal and the posterior are 8 millimeters, size 3 to 11 is 9 millimeters distal and posterior. Again, we looked at the tibial morphology, very similar to what we've already heard earlier. Virtual sizing and placement of the components from 6 different systems. And you get a much better coverage with the Persona anatomical tibia compared to the other. This is really a repetition of the earlier presentation. We won't dwell on this. Again, in terms of the femoral morphology, when we did at the zebra analysis, the virtual sizing placement of the components from 6 different contemporary totally designs, we found that the anatomical APML dimensions and coverage was arguably the best within the Persona system. And to avoid overhang components, maybe downside, this actually leads to an additional time during surgery, whereas with the current design, you have a choice of standard narrow, and you can just go from one implant to the other. I'd like to thank you for